fever, your ideal stress reliever. You're rolling with DJ Lokesh on the Together We Can project, taking you through until 2 p.m. today on the 15th of March, 2023. And I'm very glad to have Michael White, an area manager for the Alzheimer Society, joining us and in the studio today. Michael, can you hear me?
Yeah, I can. Thanks for having me, Lokesh.
No, my pleasure. Actually, I've just remembered, I did see on one of the emails before you came in. Am I pronouncing your name correctly?
Yeah, that's fine, Michael.
Is that right?
Yeah.
All right, great stuff. So you're an area manager for the Alzheimer Society, and as I was mentioning in the first half an hour, Alzheimer's dementia, it's an illness, a disease which is increasing in its numbers in the UK. It's something which touches many of us, whether through family or through friends or through neighbours or what have you. So just tell us a little bit about what is Alzheimer's and dementia. Is there any difference between the two things? Is this is it just an aging issue? What is Alzheimer's and dementia?
Sure. Well, the question you asked there about Alzheimer's and dementia, what's the difference, is a really common question that people have. And people quite often use the two interchangeably or don't understand the difference. So dementia is an umbrella term. Dementia is an umbrella term for a range of diseases of the brain. And Alzheimer's disease is the most common form of dementia. There are other forms as well.
Right.
Okay. So other forms of dementia might include vascular dementia, which is the type of dementia someone might have when the blood supply to the brain is compromised in some way. And then we have other types of dementia, such as frontotemporal dementia, which, if you've seen on the news, Bruce Willis has recently been diagnosed. There's a big news story there, the actor Bruce Willis. So he has FTD as well. So there are actually over 100 different types of dementia. But Alzheimer's is the most common form. About 60% of people diagnosed with dementia have Alzheimer's.
All right, okay. So Alzheimer's is basically just a form of dementia, and by the sounds of it, the most common type.
That's right.
And so is this, you mentioned Bruce Willis. How old is he now?
I can't remember.
That would be testing your knowledge, wouldn't it, really? So, I mean, is this a problem of aging? Is it just a matter of people are getting older, people are living longer, we've got an aging population, and so some of us, just by the nature of getting older, will be susceptible to Alzheimer's and dementia? Again,
there's that's quite a common conception that that Alzheimer's or that dementia is a natural part of aging, and that's clearly not the case. We need to be very clear about that dementia is a disease, and dementia is a disease of the brain, of which there are many types, as we've said. Age is a factor in terms of it. The older you get, the more at risk you are. Okay, but getting old is not, or getting dementia is not a natural part of getting old. Okay, so we need to consider it like a disease, a bit similar to cancer. Cancer, a disease of the body. Dementia is a disease of the brain.
Okay, all right, and so give us a bit of and also, how does it affect people? In the early stages, what would be kind of some of the early signs of dementia?
Okay. It depends on the type of dementia. So the way that Alzheimer's might start to show itself might be different to vascular dementia or frontotemporal dementia. So dementia is not just about memory loss. We often think about dementia, Alzheimer's being people losing their memories, and that is a significant symptom. Don't get me wrong. But it's not just about memory loss. So sticking with memory loss for a minute, we might find that, we all forget things. Forget, where did I leave my car keys this morning? Did I shut the front door? Those kind of things. We all go through that. And as we get older, we might struggle with our memory a little bit more. Okay. But when we think about dementia and a diagnosis, we're thinking about things that are a lot more kind of significant and a lot more frequent than that. Okay. Forgetting where the kettle is in the kitchen, kind of thing, on a daily basis, could be an early sign of memory loss that might be some form of dementia.
Right.
So something that's out of the ordinary for someone, not just forgetting your keys, not just forgetting why you went into a room for something, but if that's happening kind of multiple times per day or a lot more than it ever used to, then that could be a sign. But we're just talking about memory loss here. There are other symptoms such as language skills, so the inability for people to recall words. Again, we all struggle sometimes to articulate ourselves, to think of the word that we want, but if someone's really having difficulty stringing a sentence together, or certain verbs, certain nouns they can't find in their mind when they're starting a conversation, that could be another indicator as well.
Okay.
There are other areas in terms of perceptions, so the way that the brain is processing the information it gets into the senses. Things might not taste the same, they might not smell the same, things might not look the same. Hallucinations can be part of symptoms of dementia as well.
Right, wow.
Yeah.
Well, and so, what is the consequence then for people who are suffering with dementia? Are there things that they need to put in place in their lives in order to kind of mitigate the ill effects of dementia?
Yeah, well, one of the main things we do at the Alzheimer Society is to help people live well with dementia. It's interesting, you use the term suffering with dementia, and people quite often talk about suffering with a disease, suffering with dementia. But we like to talk about living with dementia and living well with dementia in terms of it. It is a massive thing to receive a diagnosis of dementia. It will impact on your life, massively.
I'd imagine just being told that is something that would shake your
absolutely.
world.
And people describe being devastated by the news and what have you. But while we're talking about diagnosis, most people, the vast majority of people, say that they actually really valued getting a diagnosis, because if you can imagine going through those symptoms I just described and not knowing why and not knowing what that's about, it's extremely distressing. To actually know that there's an actual medical reason for it, to have a diagnosis, can be really helpful for people just to understand what they're going through, and for their family and loved ones around them to understand that as well. And it gives them access to proper treatment, some proper support, even some financial benefits and things like that. It gives them access to those things. Without a diagnosis, people really do suffer. So we were encouraging people to live well, getting a diagnosis early, and getting a diagnosis that you can then share with your loved ones around you as you choose to. It's a really important step to live well with dementia.
And so, do we know of any ways at the moment that can potentially slow down the progression of dementia and Alzheimer's? Is there a way to, either through medication or through natural means, that can aid that?
Yeah, there is no cure for dementia as yet. That's important to understand. There is no cure, but there are things, as you ask, around ways we can live well and things we can do to slow things down. So on the medical side, and I'm not a medical expert, so forgive me for not giving too much detail on this, but there are drugs around that that can be prescribed that will help to reduce the impact on the brain, if you like. So if you think of the brain as a series, in all of our brains, if you think about the nerve cells that connect and keep things moving, keep things working and functioning for us, you imagine they're a set of fairy lights that you might get that go to twinkle in a certain order, in a certain sequence. When someone has any form of dementia, that upsets the sequencing of those fairy lights, triggering through the brain. So, and that's all about the connection between nerve cells. And there are very different reasons why, depending on the type of dementia, that might be the case. So I mentioned vascular dementia, incorrect blood flow, faulty blood flow, if you like, going to the brain, can affect the sequencing of those fairy lights, those nerve cells. So some drugs help to increase the function of those nerve cells. They help to almost replace or help those nerve cells develop the chemicals they need to trigger and connect successfully. So that can help some of the symptoms and can reduce some of the symptoms. But as I said earlier, there is no cure. The brain is still on a journey of degenerating in that way ultimately. But they can help. They can help at different points. There's actually a drug that came out in September 22. You may have seen it. May have hit the news, and that's called lecanemab. That drug was kind of lauded in the press. It was found to reduce the symptoms or the progression of Alzheimer's disease by about 27% in the people that were involved in the trial. That's a drug which is very much about the early stages of Alzheimer's disease, so not the later stages. But that's an example of a recent success, progression, if you like, or advancement of medicine that's being tested. So that drug is currently not available. It's currently going through its stages of clinical trials. But obviously, clinical trials are one way of trying to find a cure ultimately.
I mean, do you know of? Obviously, you're not a medical professional in that regard, so I'm not going to push you too much on these points. But do these drugs come with side effects?
Yeah, as most drugs do, there are side effects but then GPs can get into or doctors, specialists can get into talking about those side effects and maybe prescribing other drugs that help alleviate that, or the lifestyle issues.
Because imagine particularly somebody who's suffering with dementia, whose comprehension is a little bit shaky. Let's say, having other side effects come in can be quite problematic. And also, we've been speaking with a number of different medical professionals, very celebrated medical professionals from around the world in recent shows, around the potential for diet to kind of mitigate and in some cases even reverse very, very serious autoimmune conditions. Is there any kind of research that you're aware of around diet and whether that has an impact on whether somebody is likely to come down with Alzheimer's or dementia? Is there anything around that you're aware of?
There's quite a lot of ongoing research about diet for obviously a host of different conditions, as I'm sure you appreciate, and that touches on dementia quite regularly. You'll see things pop up in the press quite frequently about, a certain food substance.
Right, I think there was coconut oil, wasn't there, back in the day?
There's been coconut oil, right. Yeah, there's been turmeric has been mentioned, there's been other sorts of things, vitamin B, etc. There's all sorts of different things, and we always, at Alzheimer's Society, we approach those with caution, because we always go, we have a very strong research arm within Alzheimer's Society, and we're always very focused on the actual research and the evidence that's coming through scientific programs. So in terms of healthy eating being a factor, it's absolutely about having a healthy diet, both as a preventative measure for all of us in terms of moving forward. What's good for your heart from a health point of view, what's good from a diet point of view, what's good for your heart is good for your head as well. Okay, yeah. So thinking about things like vascular dementia, people who may get dementia or some form of dementia after a stroke, when that affects the blood flow to the brain. Preventing a stroke situation, we're talking about healthy eating, we're talking about exercise as well. So a healthy lifestyle, we're talking about, not smoking, we're talking about the effects of alcohol on the body and the brain as well. So keeping that to a minimum. So there's all this so it's generally about living a healthy lifestyle, an active lifestyle as well. And also people, as a preventative measure, or even people with a diagnosis, cognitive stimulation is kind of a really important. This touches on the kind of non-medical side of what we can do to live well with dementia. But as well as the medical issues we spoke of earlier, there's things about different group settings. It's very easy to become isolated when someone has a diagnosis. So working with carers, with support workers, such as we have at Alzheimer's Society, or family members, going to groups, any kind of group activity, social interaction, really important. Cognitive stimulation, doing crosswords, doing puzzles, learning something new, learning a new language, people learn an entirely new skill, or picking up a hobby they had when they were younger, perhaps. I've heard of examples, people picking up swimming again in their 60s, 70s after a diagnosis. Used to be a kind of gala swimmer in the younger years, getting back into that, rediscovering things, all that stimulation being really positive on the mind and on the body.
I can see that as being really, really important, right? I think for all of us as we age, kind of keep the mind active. We've got to keep it. It's a muscle, isn't it, to some degree? So we've got to keep it working as much as possible. Currently we've got some medications which might help with slowing the progression, but they certainly don't cure it. Diet is important because, as you say, one of the areas of dementia is vascular dementia, and obviously so oxygen supply around the body depends upon having clean arteries, or clean enough arteries to do that, and also get nutrition around to the body as well. I imagine a lot of people who suffer with Alzheimer's and dementia depend upon a family member or a carer in order to kind of get through. What kind of impacts do you see with carers?
The effects, the impact and the effect on carers and on family members is huge.
Yeah,
I think it can't be underestimated. Really, it's if you've lived with someone, you may have seen the TV advert that we've got going at the moment, actually on mainstream TV. Really powerful advert, which just shows a very succinct picture of a journey between a married couple, and one person, again, dementia, the impact it has on that person's partner as well. But it could be children, it could be wives, sisters, brothers, etc. Having seen, living in close quarters with someone who's got memory issues or is on that journey towards getting a diagnosis, they go through that confusion, that fear, and that anxiety around what's happening. Why can't that person remember where they are today, or why they're here? Why did they get lost? Why did they keep leaving the house and not coming back? All those kind of things, and the confusion that builds up. These things don't happen, or very rarely happen, overnight. So it's a progression. It could happen over months. It could happen over years. So the impact is massive, changing someone's behaviour. Obviously, further down the line after a diagnosis, as someone progresses even further through their dementia, they get to the point where sometimes, and quite often, people will forget who family members are, forget their partner, and will actually start to regress in terms of years of their life. So go back to when they were living back when they were living in the 50s, back to when they were living in the 20s or even younger. So kind of forgetting those things, those later parts of their life, and regressing back to a younger period of their life. So maybe wondering why certain objects don't appear in the house anymore. Maybe wondering, wondering, what's this thing that we would call a computer, not understanding, not even recognizing that particular object. There's that kind of object recognition and what have you. So those are the kind of negative things that people can go through, and the stress that can cause anyone in a caring situation can find their life turned upside down in terms of being the daughter or granddaughter of someone, to then suddenly becoming their primary carer. So you're actually kind of reversing roles there. So you might be, your parent may have always looked after you, or looked out for you, or looked after your best interests. All of a sudden, within the space of a few years, you're looking out for their best interests. Yeah. You're thinking about what time they go out, where are they, what time do they come back, what are they eating, what are they drinking, when do they go to the toilet. That's all those kind of things. So it's a massive impact, especially for people who live with someone with dementia, but also people who don't live with someone with dementia. So it could be more distant relatives, family, friends who may feel uncomfortable, and this happens quite a lot, may stop visiting their relative with dementia because they're fearful of it. Maybe they feel there's a stigma around that. They don't understand it. They fear that, well, what's the point in going to visit my grandparent with dementia because she won't recognise me, won't know I've been there. And one of the things we talk about is that even though that person's memory, short-term memory, may have degenerated to the point where they don't even recognise you or they know who you are, they won't remember that Lokesh came to visit me yesterday. They'll be left with the feeling that they had when this nice person, this nice man, this nice woman came along, visited me, made me a cup of tea and sat and talked to me for half an hour. They'll be left with the same feelings that they have from that, even if they can't remember the actual event. So that's why it's really important that we always encourage people to stay with that person with dementia. Okay, every person with dementia is different, and every journey is different. But stay with that person and keep visiting, keep in contact, and keep there, because they will keep that feeling. Because if people around them don't continue that, then that's when isolation sits in. That's when they don't go outdoors. That's when they don't go to groups. They don't go to the cafes, the social groups that they always used to, perhaps. And that can kind of actually accelerate the progression of dementia.
Yeah, I think there's something about society where we don't really want to face things like those three things, probably old age, illness, and death, and so those three things can often end up with kind of people staying away, and people become more isolated with that. It's unfortunate. Actually, just occurred to me now that Buddha himself became Buddha because he had to face old age, illness, and death in one moment, right? So maybe there's some sort of another truth in there somewhere. It certainly is something that must build a lot of pressure, for carers who have to flip roles and change their lifestyle completely in order to be a carer. And more than that, the person that they love, and they love, they relate that to certain memories maybe, and then suddenly those things are all gone and the person's very, very different. Must present a lot of challenges. So at the Alzheimer's Society, you've got three main prongs to your approach. One is dementia support services. The second is that you fund dementia research, and the third is campaign action. So talk to me a little bit about that. Talk to me a little bit about the kind of support services that you provide.
Okay, great. Yeah. Well, my role as area manager is about delivering those services and helping manage those services, helping create those services, helping to get the funding for those services as well. Mm. So we provide a whole range of services in West Yorkshire, in South Yorkshire, across the three nations of England, Wales and Northern Ireland. And we work wherever we can to provide individual one-to-one support, one-to-one advice for people. So we have dementia advisors and dementia support workers who are well-trained and well-supported to go out and meet people on a one-to-one. So that could be on the phone, it could be in someone's home, it could be meeting in a public place, it could be going to different activities with them. And we've also got online support as well that dementia advisors can support people with. We run groups, as I mentioned, about social isolation and trying to avoid that, trying to keep people out there doing their social activities and what have you. We have specific dementia cafes, which is kind of like a coffee morning kind of model where people can go along and meet other people with dementia and other carers as well. We have activity groups to keep people active, to keep bowling groups, things like that, kind of sporting or craft groups and what have you. We have cognitive stimulation therapy in some parts of the country where that's about really kind of making sure that we are keeping people's brains active and keeping them, doing that kind of puzzle work and that kind of learning new skills kind of activity as well, and things that are proven to help people with dementia and different forms of that. And then we have awareness sessions as well. We run awareness sessions for carers, for people with dementia themselves, about all the things that we're talking about today in a lot more detail, about how that might progress over the course of years, what the people might expect, what does different symptoms mean, and what have you. We then have, so those are all kind of local offers that we have in terms of support. Helping people get a diagnosis is massive, and that's one of our main strategic outcomes that we're trying to achieve, is trying to get much more people to get a diagnosis and get the support that they need. So going to see their GP, helping them with what happens after that.
Why would it be difficult to get a diagnosis, or what challenges are there in getting a diagnosis?
First of all, we touched on it earlier about that perception of dementia. It's a natural part of aging. My grandmother, she's starting to lose her memory. She's starting to lose her brain function. It's just because she's 85. Right. So it's kind of living with that kind of that assumption, if you like, that it's natural and there's nothing you can do. That's still quite a prevalent view, which we need to challenge, and that's what our campaigns are about. So it's not a natural part. It's not about getting old. It's about getting ill, basically. It's one of our campaign messages. So that can be an issue about people just thinking there's nothing there to diagnose. Secondly, there can be stigma. There's certainly some sections of the community, some of the population, there's much more of a stigma attached to that, and people fearing what their relatives or friends or neighbours might think. That can be an issue. There's actually an issue in terms of healthcare professionals themselves as well, in terms of knowing the value of a diagnosis. Sorry to say, there have been instances where we've had even GPs don't see the value in a diagnosis and just think it's part of aging. We can't cure it, so just let them be. Right. So we're challenging those kind of things all the time and trying to encourage people to go see their GP. And that's what I would say to anyone who's listening today as well. If you know someone or even yourself who are having issues with memory that you think are significant and that are affecting your life, or you think a relative is behaving quite differently, and you think from what we've talked about today that there's an issue there, go and see the GP. That's the first. Make sure you're registered with the GP. I know some people aren't, but make sure you're registered. Make sure you go and speak to someone about what you're going through, and then take it from there. And of course, you can go to our website with loads of information on there about getting a diagnosis, about all the things I've talked about today, about different types of dementia, the different symptoms. We've got handbooks which you can send out for free in different languages as well. There's loads of information there on the website to look at. So that's alzheimers.org.uk. So yeah, really important to get people to help people get that diagnosis and move forward.
Okay. And so some other things that you do at Alzheimer's Society is you fund dementia research. So what kind of research do you fund?
We fund a whole range of research programs. So we hold a research fund, which is mainly funded through the donations of the general public and and sometimes through large corporations as well, and corporate sponsors. So we have all that. Our fundraising arm is massive and will help us to fund some of the services I talked about earlier, but also the research program. So we have a research panel, which includes people who are caring for people with dementia, includes people with a diagnosis of dementia as well. So we have a lot of people, our ambassadors have dementia and are promoting the messages about living well and what have you. So people sit on those panels, and we have different universities, different research bodies and what have you coming to the Alzheimer's Society with a proposal. They want to do a research program on the, let's say, the impact of a certain drug on the brain, the impact of a certain food substance or certain diet or certain lifestyle approach.
Have you had that? Have you funded research for a food substance or a diet or anything like that? Has that?
I think, well, we've certainly funded things into healthy lifestyle, which would include that, yes.